Welcome to Talk 1260 KTRC. You're listening to the Humanity Behind the Vanity, a show about plastic surgery. I'm Dr. Daniel Ronel. This is my wife, Betsy Ronel.
Hello.
And we're going to continue our discussion from last week. We also have Scott Thomas this week.
But we got cut off because we talked too much, so we're going to continue our little talk that we had last year about secrets to looking 10 years younger.
Last week, not last year.
Last week, sorry.
I just don't think we got into it.
Oh, no, it wasn't last year. Was it?
Yeah, actually, no, it was the first. That's right, it was the first of the year.
All right.
So, we just didn't get into it deeply enough.
Well, so what I want to go, I'm going to outline it for you, and then you can delve in.
Okay.
So, an age eraser. One of them is use fat to get fuller cheeks.
You're looking at the new beauty magazine.
I'm looking down. Sorry, I know this is not bad. This is not good media, but I'm looking down at Madge. And one of the things we discussed was wider eyes, which you discussed, a blepharoplasty.
Okay.
Is there anything else you can do for wider eyes? Botox?
Botox can sometimes help change the shape of the eye, but it really depends on what the person's eye looks like. The eye itself is surrounded by circular muscle, and in some people that muscle really does constrict too much, and it can close the corner of the eye down, and that can be helped with Botox. But in most people, no. In most people, you really need surgery to change the shape of the eye. Now,
to get wide eyes, do you need an upper eyelid tuck or both, lower and upper?
That's a good question. It really depends on where the excess skin is.
On the spot.
Okay, in some people, actually, you don't even need an eyelid tuck at all. You need a brow lift.
That goes into the next segment here. Okay. A smooth forehead.
Yes,
segue.
So, one of the other very strongly rejuvenating techniques in this new beauty, secrets to looking 10 years younger.
They don't pay us for this, we just happen to both like it very much.
Is to rejuvenate the brow. And the aesthetic position of a woman's brow, and for those of you watching on YouTube, I'm pointing, the lateral third of the brow should be above the rim of bone here, the orbital rim. In a man, it should be at the level of the bone. And so to lift the brow up laterally, you can do a little brow lift, which is with a small incision behind the hairline. Almost
at an angle directly above that section of the brow, right?
We used to do brow lifts by doing a big incision all the way across the brow like a crown, but that's been found not to be necessary. And the endoscopic brow lift, which is when a brow lift is done with a little camera, is a similar technique that actually has a third extra incision, and I'm not a huge fan of that, and we can get into that some other time. But this brow lift procedure, which elevates the lateral third of the brow, is very rejuvenating. It's very quick and easy to do. In fact, I do it in the office.
That's easy to do because you just numb somebody up like that, like you do from my injections.
Yes.
I've yet to have a brow lift, but I'll get one. Okay. And then the other topic we discussed was full cheeks, my favorite subject. And in here, actually, one of your professors, now one of your colleagues, Dr. Lloyd Gale out of New York City's Columbia University program, where you were trained, talks about fat grafting or fat transfer. And let's read what he says. Fat transfer can really help enhance the cheek area and give the appearance of higher cheekbones. That's what I personally strive for all the time. Plus, some studies show that fat transfer can help improve the overall complexion because the fat is rich in stem cells. Discuss.
Stem cells are one of the hottest topics these days.
Even in this magazine.
In plastic surgery and in medicine in general. And they're sort of like the fountain of youth. I mean, they are the progenitor cells, the first cells from which all other cells come from.
Isn't that why we save the baby umbilical cord or whatever that deal we do is? Okay, that's what we do personally.
Right, that's
but that's in case they get injured, isn't it?
That was developed for the immune stem cell. But there are many types of stem cells. There's liver stem cells, there's skin stem cells, and what we don't really know a whole lot about the clinical applications of stem cells. There are reams and reams of data of the scientific study. 20 years ago I was studying this for my thesis in Princeton about stem cells for the immune system. So we've known about them for a long time, but the clinical application of it is just now starting to be found. And
the beauty application of it.
Right. What Dr. Gale, who's one of my favorite people in the entire world, says is that when you put skin stem cells into the face, they just generally improve the general health of that area of the face. And so the complexion, the luster of the skin, the fullness of the skin, how much fat is retained, all that is improved by putting stem cells into the skin. Now the question is, does that last? Should you inject them? Do you put it in a cream? Nobody really knows that.
Right.
Yeah.
For the fat transfer,
right.
Just to go back to that for 1 second, what about people with those severe acne scars? Would it help their skin?
It depends on whether the acne scar is a depression that needs to be cut out from the inside, or whether it's just a divot that can be filled. A lot of times acne scars can't really be filled that well.
Oh, okay.
And the thing about fat transfer is that technology too is still somewhat being developed, because the average length of time that a fat cell will live once it's been transferred is really not that long. So it doesn't last a very long time.
I had it done years ago, I think before it became popular, and I didn't realize what the plastic surgeon was doing. He was an excellent plastic surgeon. This was way before I even met Daniel. And he took it out of my butt and put it in my lips with no numbing stuff, no nothing. I cannot tell you, he did one half. I really had to debate whether I wanted the other half done. Goodness! Anyway, so, but it went away very quickly in my face.
Right.
I also don't have a lot of, I have a lot of fat on my butt, but I don't have a lot, unfortunately, on the rest of my body. And so, is that why it went away? Because I'm not sort of a fatty person?
No, it went away because the technique still hasn't really been developed that makes it last a long time. Okay. There are some people, like Sidney Coleman in New York and some people in Brazil, who are masters at fat transfer.
Yeah, the Brazilians sure
are.
And
they really know how to make it last. Not all Brazilians. In fact, a lot of the Brazilian butt lifts just don't last very long.
Oh, really?
And so there always is research being done on how to make these fat transfers last. And that has to do with the stem cells in the fat. We're talking about all the same things. So,
okay. So it's just a matter of personal choice, the doctors and the patients, and what application you use.
It's not just fat. For example, when you do a facelift and you can cut out some of the connective tissue, the fascia of the skin, and you can put that, for example, into the nasolabial fold, and that's much more durable. Larry Reed taught me that, who's also one of the people in New Beauty.
Magazine.
He's one of the editors of New Beauty magazine,
awesome.
And that's a very interesting technique too. So it's not just fat. It's the whole subject of stem cells is really now just starting to explode. Not because we know exactly how it works and how long it lasts, but because studies are now being undertaken to answer those questions. We actually have to wrap this one up. So, thank you for listening. I want to thank our sponsors. We're generously sponsored by Suniva, the makers of Artifil, and iFlow, the makers of the OnQ Pain Pump. And stay tuned. Scott Thomas is coming up next, and then afterwards we're going to talk some more about these new things in plastic surgery. You're listening to Talk 1260 KTRC, the Humanity Behind the Vanity. We'll be right back.